I'd like to welcome everyone to this webinar. This is one of the many webinars we do. I'm Francis Seeley from GlobalNet21, and we do many webinars on a number of issues. And we're doing a series with Travesdreams and Marina Finetto, who you will see in a minute, who's helping us with this. And we call it Conversations Across Borders because we look at problems that are global and that often have and almost always have local impact. And the big crisis today that's global, that has local impact, is coronavirus. And we've got Iboro Otu with us today, who's from Nigeria. And we are so sometimes engrossed with our own crisis, we don't realize or think about how it's happening elsewhere outside of the UK, outside of Europe. But it's happening in other countries, and it's happening with severe consequences. And so we're going to talk to Iboro about Nigeria and Africa and what the impact of that is there. So thank you for joining us, Iboro. And can I start by asking you, first of all, if you could tell us just a little bit about yourself and your background?
Oh, thank you so much, Mr. Francis, for the opportunity. I have business interest in Nigeria in agriculture, construction, and media. I am trained in these areas as well. And but I'm also a politician. I ran for the office of the governor of my state, Akwa Ibom State in Nigeria, one of the 36 states, and it's an oil-rich state. And so it's going to be very interesting to speak about Akwa Ibom State as a case point with this COVID incident.
Iboro, why did you become a politician, or would you like to become a politician? What does motivate you, and what kind of aspiration do you have?
It was as a result of the inequality and a lot of other challenges we still have in Nigeria at the moment when it comes to inclusive prosperity and effective governance in Nigeria. And across Africa, having gone around the continent and spoken to a couple of people, especially there in the UK, I've come to realize that the Nigerian problem is an extrapolation of the African problem. So I thought I could offer more service to my people. I could do better than what's now available, and it's been interesting. Even though we got involved in the race in the last elections, we were illegally excluded from the Election Petition Tribunal, and at the moment, I'm taking that up at the International Criminal Courts to see how we can address this through the fundamental human rights angle of things.
Okay, so you're involved in a lot of things, and particularly human rights. And in this particular webinar, we're going to talk about coronavirus, the COVID-19 epidemic. And that's affecting every country and all continents. And the response to that crisis is different in different areas. Can you tell us a bit about what the situation is in Africa, and particularly Nigeria, where you live?
It's really hit hard in Nigeria, looking at the fact that we depend on crude oil to generate revenue. So when this effect has hit us, I mean, like every other country in Africa, the hardest economically and health-wise, it's really a challenge to know how to really ascertain what the impact is at the moment, because getting information is really hard. But from records we get from the Nigerian Disease and Control Center, we know that about 135 people are being tested per million, which is really low. And the reason for that is because over the years, the health sector of Nigeria has been very unprepared, just like every other sector, whether it's in agriculture or education, all the rest of them. Leadership in Africa across has not been really very, the gains have not been consolidated or spread across to the rest of the country. So when this event happened, it exposed the lapses in the system. Generally in Africa, only 51,000 tests have been carried out. And you're talking about 1.3 billion people. And with about 900,000 tests being carried out in Africa, that shows you about 700 per million. And when you don't test, you can't really know what's going on. So we are trying to see how we can find ways to get the government to do what it's supposed to do. Of course, the World Bank and the IMF, they've put in some $18 billion each, and some other institutions are trying to see how to support the health system, how to help countries support the poor, and with palliatives and also the business sector. But it's not really, we're not seeing the effect because it's too early to see this against coming. But the only thing happening right now in Nigeria, for example, is the lockdown. People are, you have police everywhere and the military and people allowed to move around, which works. But because 80% of the workforce of Nigeria depend on the money they earn in the informal sector, hunger has become a very big problem. And as such, people are finding alternative routes to see how to survive. The government has also indicated that the measures to take care of the very poor, but then data is not readily accessible. So it's very hard to tell what's really the impact of the different strategies put in place by the Nigerian government. Nigerian loads of information, the state of tests carried out in African countries, the number of intensive care beds that are available and ventilators, the number of doctors that are available. It's just opened up the abysmal state of different sectors in Africa. And but we hope that this also would be a rallying point for young people, for the diaspora as well, to see an opportunity to take advantage of these areas of investment that might be good to plug in and, you know, help get to turn Africa around.
Iboro, if we look at the more perspective, African perspective, how do you think that the different countries are reacting to the situation, and what kind of mood of what kind of feelings do the people have there? How do they are reacting to the situation?
With the government, I mean, a couple of days ago, they met with international funding agents to find some capital to come in and support the different, plug in the different holes that are on the ground. So basically, they're facing the same problems of people getting out of work, which is happening rapidly across the continent, people having inability to buy food to survive and no access to test kits and all the rest of them. So the challenges are the same, but with the people, we are across Africa, people are not feeling the impact of these measures that the government are announcing on air that they're doing. So when I speak with several people and our contacts across the continent, it's the same thing. A lot of people are not tested, even those that are sick, because either the test kits were donated and they are not functioning, or they are not available. In fact, it's so bad that taking my state, for example, in Nigeria, Akwa Ibom State, there's an allegation which is on the internet that the state government is actually trying to make sure that the tests are not carried out as much as they are supposed to, because they are afraid that when the numbers are too many, they rate negatively on the state. So when you see governments working negatively against, not so they don't have the right numbers, it goes to show that we have a much bigger problem than it's supposed to. But I'll be honest with you, a lot of people don't really care about Corona when you see the way they're moving. With the lockdown across African countries, mostly in the urban centers, the rural centers people are relatively free. People are worried more about hunger, because 80% of the workforce in Africa depend on the informal, they work in that operate in the informal sector. That means they earn money per day. People are more interested in making money to take care of their family. But then the working class as well, a lot of people are losing jobs, and Africa traditionally doesn't have this support system like you have in the UK and the US, where unemployed people are given some kind of support. So the COVID-19 situation is making this arrangement happen all of a sudden, and they're not really being carried out properly. So again, for example, where you have the Ministry of Humanitarian Affairs saying, oh, we've shared about 100 billion to poor people, you still don't have any data to indicate who and where and how it's being shared. So when you speak to people in communities, a lot of people still say, oh, we didn't get anything, there's no money coming in. And so with people are very wary right now on the continent with government, with how they're handling the situation, and people are just trying their best to see how to survive.
So when you say they're very wary of government, does that mean they realize there is a crisis and they're, developing their own way of dealing with it? Or does it mean that they don't see that the crisis is as important as getting in work? and therefore they would rather risk the virus than lose money?
Very good question. Some people see the crisis, but a lot of other people don't believe that it is what it is. I think the number of people not believing is really reduced because, unfortunately, a lot of prominent people died in Nigeria after the president who died of corona, and they reset the mindset of a couple of people. But the thing about hunger and not being able to take care of your most immediate, your needs and the needs of a family, which makes a lot of people, get out on the streets and try to earn a living. So in as much as people are aware that the corona effect is here, they believe that the effect of poverty and hunger is even worse. And this forces them to get on the streets to do their best to survive. So when you Google activities in Lagos, for example, you still see situations where buses are full, where public centers are full, and there's no social distancing. And when you speak with these people, you realize they are aware of what is happening. They understand the implications of COVID-19, but they just want to do what they have to do. They just need to do what they have to do to survive.
You wrote that the bottom-to-top approach is the only way we can address our many challenges, not regarding coronavirus, but if we see the situation where it is, where we have, of course, a corona situation, but we have also many other problems, economic problems that need to be solved. How do you think that this kind bottom-to-top approach in corona could help? Also, what are the voluntary sector NGOs, what are they doing?
One of the things that happened I take Nigeria and my state, for example, was that with sharing some of the palliatives to the poor people, the political structure was used. And what happens in such instances is it doesn't trickle down. And now people are aware that using the traditional approach would work better. So the bottom-to-top approach would basically mean empowering and giving more resources to traditional channels, like the chiefs, because they better understand the environment, they know their people, and they can police, they can test, and they can isolate much quicker than the government parastatals and agencies. So they very much have to be carried along. But then politically, that means that community development should be a priority when it comes to development, all true. A lot of agencies are working hand in hand with the government ministries and parastatals to see how they can help with the situation. But, it's only data collection that can be done. There's not much because of the amount and the staggering effect of this crisis that organizations can do. But then I believe that with time, as we move forward, that probably the communication between the government and these agencies will help them work better, because with agencies, they work with data. And if you can't get data, it's very difficult to know where to plug in your resources. So hopefully with time, we will see much more result than what we are seeing at the moment.
It's interesting what you say about, devolving things to traditional ways of doing things, tribal leaders. When I was younger and I filmed in Ghana, there was what they call decentralized cooperation. That's cooperation between national government, regional government, local government, tribal communities, and non-government organizations. So are you seeing politics change in Nigeria now from a top, more authoritarian type of democracy to one that's more decentralized in the way that I've mentioned it there?
I believe the future for Africa, for its own survival, would be decentralization of power. And a lot of things are unraveling at the moment. Looking at Nigeria, for example, the dwindling prices of oil means that states in a couple of months, just a few months down in June, may not be able to get the allocation, may be having zero allocation because nothing would be coming in from crude oil sales. And supply chains, businesses are being shut down, and the federal government does not have the capacity to take care of the needs of the people. And what now happens is that there will be massive unrest, crime would be high, and with this, coming up, people will start asking serious questions. So for the survival of the country and the survival of the different governments, they basically would need to do the needful, giving state governments and local governments and regional governments the ability to take advantage of the resources they have that's available to them to support their own people. So in answering the question, I believe going forward, this would bring about Africans, especially young people, asking serious questions about leadership and also finding ways to make sure that empowerment in terms of regional governments, local governments, senatorial districts, all the way to the governors, these different governments are given more power to act directly. Because as it is at the moment in Nigeria, that's not the case. The resources basically come from the federal governments to the state governments and stops there. Beyond that point, it's very, very, very hazy. But I guess the resources are no more available for them to play around with. And when the patronage kind of leadership is no more working, people will start asking serious questions. For example, a lot of doctors, a lot of people came out like a month ago and they challenged the state government, they challenged the State Commissioner of Health that he was telling lies about the test. And this has led to a lot of major arrests. So if you go on the internet, for example, you'll see a lot of international organizations asking for the release of some journalists in the state. And this goes to show that the government is really worried and they're trying to control as much information as possible. What you see with these clampdowns, when people start dying, things are just going to unravel and the truth will be forced out one way or the other. But we hope and pray that state governments, federal governments, and all arms of power they all do the right thing.
How is the health system or health sector functioning right now, and what do they see? And so where I'm in Sweden, there are a lot of discussion also coming from different scientists and from politicians. How is the situation there?
The health sector in Nigeria, and just like every other sector, a lot of other sectors, it's been bad, not good enough. And I tell you, for example, in a country of 200 million people, we have just 350 intensive care beds. And that with statistics showing that about 123 million Africans would probably have this virus by the end of the year. And you have about 10,000 intensive care beds, whereas we need 111,000 in Africa. It goes to show that there is a lot of lapse, and so it calls for serious intervention. I know that about 57 billion has been earmarked for Africa, but we need about $330 billion to be able to manage the effects of the coronavirus. So again, going back to the test, like I said, 135 people are being tested in Nigeria per million. In Europe is about 23,000 people per million. So the difference is a lot. And like I said, when you don't test, you don't know what's happening. And a lot of professionals in the past year, doctors, they all left the country a long time ago. So we are in need of hands that understand how to even operate the ventilators and take care of the patients. Protective equipment are unavailable. Test kits are at best faulty, at worst not even available. And but then this is just with the coronavirus. You have people who originally have had their ailments, whether it's cancer or malaria or whatever. So the system is very, very weakened. Right now, the best the states can do is do some level of patchwork, like have centers, isolation units. But even at that, the numbers are not encouraging. But we go on, please.
Yeah, I was going to say, I mean, you talked about the lack of testing, you talked about the strain on the health infrastructure, but it has an impact on public health as well, doesn't it? I mean, for example, in parts of Africa, you tell people to wash their hands, but they've got no water. They have to travel to get their water. So how in Africa do people manage when the public health structure is not adequate? What can you do about that?
Well, in some places it can be very bad, like you've mentioned, where people don't have access to water and soap. especially in the rural areas where you actually have vast majority of people. In the urban centers, people have relatively been taking good care of themselves, but in a country or in a continent where you have one doctor per 100,000, not a lot can be done with such number unless we bring in more hands. So in answering your question, I think what the government can do, and they're trying to do, is find ways to make this basic, the basic things available, like water and soap. I mean, boreholes are easy to drill in communities, but how quick can that happen with the bureaucracy and the political hegemony? Allow this to happen in quick time, even when the resources are there, because then it's the system. We all understand that the African political system most of the times riddled with the graft, and that could be a problem. But my hope is that looking at the impact of this economically and otherwise, that it would compel our leaders to act really fast to make available the most basic things like hand sanitizers, face masks. And I'm happy that a lot of local people in Africa are using Ankara, for example. I'm really proud of a governor in Cross River State that has been able to make this Ankara masks. The effectiveness of the question, but at least it goes to show that some innovation is taking place, and who knows what could happen down the line. So I'd rather encourage the governments across the continent to do what they can to get the most basic things across to people: soap and water and hand sanitizers, face masks, and the rest of them.
And do you think that they work good enough, let's say, with communicating what it is about and what you can do to protect yourself as far as you can do, say social distancing and washing hands and the basic things? Because this is something, for example, that Sweden, they do not have lockdown, but they spend a lot of money in trying to educate people. Is something that is happening in your country or in Africa, or do you think that you could do more in this direction?
A lot is being done in that direction, actually. A lot of agencies like the NCDC, even the INEC, for example, in Nigeria, that they're doing their bit. And across Africa, even when you go online, on Facebook, everywhere, there's a lot of information. But then people in rural areas don't go on social media, and they don't have the apparatus to watch CNN or do these things. So the local radio stations, the government is taking advantage of the stations to propagate these messages, because every state government in Nigeria owns a radio station, even the federal government as well. I congratulate them for that. And across in Kenya, for example, in Ghana, it's the same results. There's a lot of information. But, when you are giving information to someone that doesn't have the capacity to do, apart from staying home, to buy the soap or get water or have the hand sanitizer or buy the face mask, is just a waste of effort. So for me, it's while you're giving out the information, I believe that the testing rapid, because there's no point in locking people in when you actually can't test. The whole idea is to be able to isolate people that are sick and test others as well, which test kits are not readily available. So I would ask the government, while they're busy giving out this information, asking people to stay home, they should also take advantage of the opportunity to test people. Again, like I said, a country that tests less than 100,000 people out of 200 million, that isn't really serious. 137 per million. So even though they're doing their best, I commend their effort. I think a lot more should be done. But beyond that, the government should also look at the economic impact. Most people are not staying home because they're hungry, because the palliatives are not drilling down and getting to the roots. A lot should be done in that sector to make sure that people, both in the formal and the informal sector, are protected.
I'm based in Sweden, and Sweden is economically perhaps in another situation than Nigeria. But even though it is another situation, they are not testing that much. They are telling, or they have been telling for months now, that they are going to scale up the testing numbers, but they have not been able to do it yet. And this is my question, even. Also, I do not, of course, I do not know what kind of situation we have worldwide. Why it is that difficult to have this test capability, that there are countries that are doing pretty well, others they are not doing pretty well. Sweden, for example, or Nigeria or other countries. Are you getting help from outside?
Like I said, the IMF, the World Bank, international donor organizations, the United Nations, the pulling resources together for Africa, which is very commendable in many different areas. I know that 2 weeks ago, the American president did mention on CNN that he's sending about over 200 ventilators to Nigeria. I believe there's been some level of support. A lot more needs to be done. I mean, especially in the areas of intensive care beds, ventilators, PPEs, face masks, and all the rest of them that are needed, test kits that are needed on ground. But in Africa, it's same issue. The inaccessibility of these different equipments, and even the doctors and nurses are very few compared to the population. So I'm hoping that with the various announcements that have been made from last week or 2 weeks ago, we should be able to see things happen quick enough. But unfortunately, we also know that China, India, major countries that are good at producing the equipment we need are overwhelmed. So we can only wait to see what other countries like, I know the British government, for example, they've asked companies to start making ventilators, same as the American government who asked Ford and GE and other big companies to do so. And also we are praying that the vaccine come out soon enough. I know there's an estimate for the end of next year. My hope is that maybe what Madagascar is doing or some other country can surprise us, maybe.
Okay, I mean,
Sweden.
We're all praying for that.
Yes.
But you know, you talked about the slowness of government to react, and that's happening all over the world. It's happened in the UK, it's happened everywhere. And what was amazing here, and I'm sure it's happened with you as well, the way in which the community sort of stepped up to the mark. They got volunteers, they worked together. In Nigeria and in Africa, particularly Nigeria, have you been amazed about how the community has sort of developed their own ways of coping with this?
Yes, I'm very excited. I mean, I spoke with a friend of mine just before I called you. I believe the change we need in Africa needs to start in communities, otherwise we wouldn't be going anywhere. And I tell you, because of this corona issue, a lot of vandalization and robbery has been taking place at night. And the communities just came up with the vigilante groups. And the robbery stopped overnight because the vigilante groups know where the robbers stay, they know who the robbers are, and they know how to protect themselves. The reason why they're unable to isolate and test is because the kits are not available. You see, I believe that if the communities are empowered, if the government can step in with the kids and show the communities and the traditional rulers and the youth leaders and the women leaders how to go about these things, it will bring about the change. What's really lacking now is the apparatus, but the people are ready to act. And it's quite interesting to note and watch, see how, because nobody wants to die, whether they're rich or poor. And they try to do all the best they can to survive. So even when people are going about their businesses, when they get sick, their neighbors know this first and they report to whoever is in charge of the area. And if there's an isolation center nearby, the people are, or the people in charge are being notified of this. So it's just for the government to realize that more power needs to be given to communities and community leaders, and more of the needed apparatus and equipment should test kits, for example, PPEs and all the rest of them are sent to communities so they can, spread the good will around. Another informal, sorry, that's the wrong word. Like for example, the churches, we have thousands of them everywhere. They're very effective in reaching out. They have numbers, they have data, and it's easy for them to operate. So the government needs to be more inclusive in its approach, and hopefully we'll see good results soon enough.
Okay, we've sort of come to the end of the first half hour, so very finally, very briefly, people wanted to find out more about what's happening in Nigeria or get in contact with you. What do they do?
Yes, they can reach us through our organization, Alert Nigeria, ALERT Nigeria, NIGRA.org. Alert Africa is also operational, where we reach out to our brothers and sisters across the continent and across the diaspora. Basically, through our organization, what we are trying to do, Alert in itself stands for Ambassadors for Leadership and Entrepreneurial Responsibility for Tomorrow. Whether it's Nigeria, Alert Nigeria, Africa, Alert Zambia, everywhere else. We are trying to see how we can raise responsive people to get into office and lead Africa going forward. But then, most importantly, from my experience, from the experience of my partners, we also know that most of the times we have great leaders, but they don't have the capacity to win elections because the resources are not available. So we are championing ways to bring the diaspora in direct contact with such people, so they can have the resources they need to turn around the fortune of the country, of the continent. And I believe in time, we will be able to do this. Unfortunately, COVID has been able to expose the lapses in governance in Africa. But then I believe it's also an opportunity for serious people to start asking serious questions.
Okay. All right. Well, thanks very much for that, Iboro. That was really interesting, because I think to learn what's happening elsewhere and in a country like yours, which is growing fast and changing, and then suddenly is faced with this crisis, and how that's going to impact on your government, how it's going to change it, like it's going to change ours as well, is really interesting. So thank you for doing it. It's been really interesting half hour. So we'll end this webinar interview now.